Hi guys, Rachel Hippolyte here. So today I want to talk about chronic pain, chronic physical pain. So as you know, I work with the brain for chronic physical and chronic emotional pain. Generally anxiety, depression, and disorders associated with that. So let's talk about physical chronic pain, and this is such a ill-recognized area to work in, and it was really it was probably the area that got me into working with the brain a lot more than with the body. Obviously, being a chiro, everything initially was very mechanical and very hands-on with how I treated. I used to get very frustrated about not knowing enough on how to treat patients with chronic pain, so things like fibromyalgia, severe arthritis, sciatica that wouldn't heal. So let's start from the beginning, and you would have heard me mention this before. Pain is from the brain, it's not from where we feel it. It's a message from the brain. So pain is a perception, okay? So it's very difficult to judge somebody. Well, you can't judge somebody else's pain purely because their perception of that pain may be very different to your perception. And we use pain scales and things like that in order to judge that patient's perception of the pain. So when I treat, we would start off on a pain scale and then we would reassess after we treated. And therefore I can then judge based on that person's pain perception, whether we've made improvement. Okay, so like I say, it's from the brain. When we have chronic pain, pain is there for a reason. Okay, acute pain is needed as part of survival. We need to know if we're going to injure ourselves, and generally we actually get the pain before we've done tissue damage as a warning to stop, to let go, to get off whatever we're doing, and then the pain will then continue while we've got tissue damage. But once pain continues after tissue damage should have healed, so we're talking about that 6-week period, which is general healing, or it's there after, or it's there when there is actually no evidence that there is tissue damage, that's when that pain message coming from the brain, that perception is confused. Okay, and that's where up until recently, there's been so little understanding of it that it was just pushed away, that patient's difficult, that patient's, it must be in their head, there's no tissue damage. And this is, thank God, it's now recognised in the medical profession that whatever that patient says it is that pain, okay? So when we say it's in the brain, it's in the head, it doesn't mean to say it's not real. It is real. It's coming from your brain. You're perceiving that pain. It's just that it's not there with physical evidence. But it doesn't mean to say it's any less evident to you, okay? Generally with those chronic type pains, we really struggle with medication. What I always find with chronic pain patients is there's always an emotional cause for that pain. And I'm going to give you an example for that. Okay, so I had a patient recently that I was treating hands-on as a chiropractor. Now she had been to see numerous practitioners before, and she hadn't had any relief from this pain. So that really gives me a warning sign that that pain is a message that has outstayed its welcome. So I could definitely feel that there were dysfunctions around that area. There were definitely tender parts to touch. So she actually came to me to treat more the brain training side of it, but I actually decided that I'd rather treat her physically initially so that I personally knew, because I could feel these areas of dysfunction, that I'd done everything possible I can. We'd sorted out all of that, and then we could move on to the brain if we needed to. So I started treatment. It was very up and down. She was still feeling the pain, but everything that I was feeling was improving dramatically. to the point where pelvic rotations had corrected. It didn't feel swollen. It didn't feel boggy. I mean, these are all feelings that I've got from working in this area for the past 20 years. So what then we did is we actually started on the emotional attachments to the pain, and we used the techniques that I use for patients with anxiety. We use the techniques that I use for patients with any kind of emotional issue. And it's like peeling an onion sometimes. Sometimes that pain will go immediately after the first session and never return. Generally, it will go on that first session, and then if it returns, it's not quite as bad, but we know that we've actually missed something. So then we look into a bit more what we've missed. And this pain was being really stubborn. And so what then came up, that there was a huge amount of anxiety around this pain. There was a huge amount of focus on the fact that there was something wrong. So like I said before, when there is that real deep focus, then this part of the brain is being activated. This pain sensation is being activated. It's being given airtime, and there it becomes stronger and stronger and stronger. And that was exactly what was happening with this lady. So initially we just worked on the anxiety around it, and that her anxiety dramatically dropped on one session, and she'd stopped focusing on it, but there was still the occasional niggle in this area, and that's how she described it. It wasn't even pain anymore, it was more a niggle. And then we really, with her, one of my techniques is to get the client to connect with the conscious and the unconscious mind, okay? We kind of forget the unconscious mind. It's always there in the background, okay? It's always kind of forgotten. And because I've been working with her, she'd actually got this connection a lot easier. So she was trusting intuition, thoughts were coming up, what it might be. And it was interesting, and I loved her honesty on this. It was amazing. But the thing that popped up initially, when we have chronic pain that is being a bit stubborn, there's always a secondary gain to it. And secondary gains are when the unconscious part of the mind needs to keep that because it's gaining something more than it needs to let it go. And examples of secondary gain are that the client feels they deserve it, again, subconsciously, not consciously. So in this lovely lady's case, all subconsciously, but then because she was getting in touch with her unconscious mind, it then came forward. And initially it was that she really wanted to go back to full-time work. She'd been a stay-at-home mum for years. She'd done some part-time work at home, but she was an intelligent woman, powerful, strong woman, but she suddenly realised that her secondary gain was she felt guilty about going back to work and leaving the kids. So she wanted to do it, but she felt guilty. And so she then felt that the reason that the pain was there was because it was allowing her to have an excuse not to make that step and to go back to full-time work, even though consciously she actually wanted to. So we shifted all that. We did some neurological shifting, and with the next day she came back and it had been a lot better. She felt fantastic about going back to work. The worries of that had gone, but she still had this little niggle. So again, we worked with the unconscious mind to try and work out, and it's me communicating. It's real mediating. It's asking questions. And we then worked out what came up was that we go back into old memories. And what came up was the fact that she actually felt that with her husband at the time, that there'd been a period in the past where she hadn't felt valued, she hadn't felt looked after. And that was in the past. It was a long time ago. She'd been married, she's got children, but what came up was she suddenly realised that based on that thing in the past, that by keeping this pain, she had to be looked after because she had a reason. She couldn't function in the way she would. Again, absolutely 100%. She didn't know this was going on consciously. It was all in the background. So that was a second secondary gain, which we've now shifted. And I have absolute hope for this woman. We've made masses of progress. And it excites me every day when we do see this kind of progress. So what the moral of this story is, chronic pain is real. You are feeling pain, but it's there when there is no physical reason for it. Or in the case of arthritis, the joints have degenerated, but while we know they're degenerated, we can't do anything more about it. Therefore, we can remove the chronic pain, and then when it gets worse, we can have some acute pain. And so the moral of this story is, believe that you do have pain. Don't be ashamed of it, but know that you can get rid of it. And hidden in the background, there may be a reason that your illogical, unconscious part of the brain wants to keep that pain. So if you do want to find any about how I work, whether you maybe have some secondary gains subconsciously hiding in the background based on old history, old memories, old trauma that are still running this program, please get in touch. The results that I get are absolutely phenomenal. They blow me away every day. So that's chronic pain for you, and I'll see you again tomorrow.